Male anatomy is very interesting. First, it shows, which is different from female anatomy. Second, when things are developing in utero, those two little glands that look like they could have become ovaries, they slide down the inguinal canal, which is outside. It's where muscles in your belly are kind of crossing like this, leaving this little hole where things can descend through. It's where you get an inguinal hernia. But the testes slide through that and go to rest down in the scrotum. Testes never hang exactly equal. A right-handed guy's left testicle usually hangs just a little bit lower. And this is so that when they walk, they slide over each other instead of just sort of crashing together like that. It's much more comfortable for them. The penis elongates. A lot of people are surprised to find out before they give birth to a baby boy that sometimes baby boys are born with an erection. Most mommies figure out pretty quick that when you go to change a diaper on a little boy, if his penis gets erect, you better slap a diaper over that or you're going to get a shower. Because that's just how it works. What do we need to know about it? Let's see. What is more common in white men? Circumcision. Circumcision is a major debate still. We could talk about circumcision in that it wasn't terribly common in the United States. In the book, when it's talking about circumcision, it makes mention that white men are much more often circumcised than other races. And one of the things I'd like to point out is that's because of insurance. And now suddenly we're finding there's this big debate going on about, should I circumcise the baby, should I not have the baby circumcised? And it's a big debate now because your insurance doesn't automatically cover a circumcision. Calling it an elective procedure. You decide whether or not you want the circumcision done. In the 1940s, there was a big push for circumcision, and I'm wondering how much of that was due to the death camps in Nazi Germany. At that time, it was very easy to identify a Jewish man because he was circumcised. Nobody else was. So it was like proof positive he was a Jew. Many of the physicians saw the war coming and immigrated to the United States as well as other parts of the world. And about that time is when circumcision suddenly became popularized. It also was thought to help cure, and literally I've seen it, address that other sin, masturbation. It was thought that circumcised men didn't masturbate as much as uncircumcised men. Didn't seem to be borne out in testing, but about that time, I can remember seeing advertisements for circumcision in Reader's Digest, which was the most read book in America. Even before TV Guide became the most read book in America, or publication. But at this point, there's a lot of debate. Should there be circumcision? Should there not? I never had to make that choice for anybody, and I just feel like I got off lucky because I didn't want to have to make that choice. A lot of families agree that the baby boy should look like his dad. Circumcised or not, whatever dad is, let's go with it. A lot of people that have opted, let's not circumcise, find out that later on, maybe there is a problem. And in a small percentage of baby boys, they may get an erection and the foreskin strangulates the head of the penis and they're in screaming pain and must be rushed to the hospital so that they don't lose the tip of their penis. And they will be circumcised at that time. Sometimes with older men, and I mean almost to elderly, the foreskin stiffens and becomes less elastic and can clamp down on the penis and cause the same type of a problem. So they have to be circumcised at a more advanced age, which at that time they need stitches following a circumcision, whereas infants generally not. Okay, everything on the male is external. The scrotum, we talked about that. Oh, the penis also on a right-handed man usually points towards his left toe. A lot of people thought that had to do with masturbation, but no, that is indeed not the fact. So if you're right-handed, every bit of the right side of your body is millimeters bigger than the left side of your body. We used to be able to go through a high school yearbook and tell whether you were right-handed or left-handed by the size of your eye, because the right eye on a right-handed person would be open more. Trivia. You all need to know that, right? The scrotum is the strangest looking structure on the human body. Not really. It is rugated, which means it has ridges in it. The roof of your mouth has rugae, which are ridges. Inside the vagina, rugae. Inside the stomach, rugae. This is the only place it actually shows being external. The sperm are created in the testes themselves. They are stored in the epididymis. I love that word. And the epididymis means upon a twin. And so upon the twins, the testicles, these little tubules are about 20 foot long, just rippled back and forth, and sperm that are created are stored in that. With an ejaculation, well, let's go. First, you get the erection. What stimulates an erection? Friction. Something they just saw, something they just thought about, sometimes something they just smelled. Sometimes they're not aware what caused this erection. As men get into their 20s, they have more control over, this is not a good time to have an erection, let's push it back down here, or think it back down, essentially. 15-year-olds do not have this ability. And a lot of times boys during puberty, I've had men in my class that said, I said, how many erections did you have during high school? And they said, just pretty much all the time. Which could be a good thing with the baggy pants now. When I was in high school, they wore skin-tight pants, and they were required to have their shirt tucked in, which was, I thought, cruel and unusual punishment. So anyway, when the penis becomes erect, you have the situation of 3 cylinders inside, well, upside down, 3 cylinders inside of the penis, 2 on the top, 1 on the bottom. The one on the bottom, the urethra goes through. That's where they pee and ejaculate. All of them are spongy tissue that when they become erect, or what causes the erection, is that the blood flows in and isn't flowing out. And when that happens, then of course they get an erection and the penis becomes bigger and much harder. On young men, the erection might slap clear up against their stomach, where on older men it could be fully erect and have it more out at a 90-degree angle. Some men have scarring inside their penis, which causes it to have an angle to it. An angled penis is much less uncommon than you might think. And if you ever watch Funniest Home Videos, you've seen how much trauma men get to the crotch that you wonder they're not all terribly deformed. But apparently they're not, or there wouldn't be so many fathers in this country. Okay, so now you got the erect penis, you've got the scrotum, you've got time for an ejaculation. The scrotum takes a little jump up as the cords tighten, and at that time, you can look at the side picture. The testes are propelled up and around over top of the bladder and out. It's almost like if you had the wind up for a pitch, just so that the semen is propelled quite a ways, which is a good thing because the farther they're propelled, or the easier, the less swimming they have to do. If a man ejaculates just barely inside of a vagina, the sperm have to swim quite a ways to even get to the uterus, and then to get inside of the uterus. And once they're inside the uterus, the egg is only in one fallopian tube or the other. They got a 50-50 chance of taking the wrong tube and never encountering an egg. And why is this? It's because they won't ask directions. It's a male thing. We've all heard of it. The prostate gland, which had they developed into a female, would have turned into a uterus. It's the same type of a tissue. The urethra runs through the center of that from the bladder. The prostate sits right underneath the bladder. And so the urethra runs through it, and off in the back, here comes another entry where the sperm are. It's not semen yet because these little sperm are hard packed together and they're not swimming yet. Not until they encounter all of the fluids from the prostate gland and the seminal vesicles. Then they have the fluid for swimming. And they pick all of that up at the same time, and it's all part of the ejaculate. You realize these little lectures do not take the place of actually reading the book, and the tests will be over what is in the book. And let's see. A great number of men who insist that their girlfriends be clean shaven, as we talked before, are not shaving themselves. Although I am understanding that it's much more common that men are doing manscaping, especially men who enjoy receiving oral sex. How in the world you would shave a scrotum, I have no idea. With all those little ridges, I would think it would be risky. You'd never try to give yourself a vasectomy. Not a plan. Getting to the end of the tape. So, any questions? Ask somebody else. Ask me. Put it on your discussion board in the totally non-graded area. Share any information that you have that you think that we should have covered and didn't. And read the textbook. There will be a quiz posted this week. I'm sure you will enjoy it.